Hello, my name is Dr. Donald Lyle from the University of Glasgow. I am going to talk to you about our paper in Diabetes, Obesity and Metabolism entitled Testing for Association between Exonic Glucagon-like Peptide 1 Receptor Mutation with Physical and Brain Health Traits in UK Biobank. Clinical GLP-1R agonists like exenatide and semaglutide have demonstrable efficacy at lowering risk from cardiometabolic conditions, particularly type 2 diabetes, via several mechanisms, including improved insulin secretion, lower blood pressure, and lowering of body weight and appetite. There is evidence from previous studies that treatment for someone with type 2 diabetes with a GLP-1R agonist may help protect brain health, including lowering subsequent risk of Alzheimer's disease. A limitation of randomized control trials, however, is that they are often relatively small in terms of sample size. An alternative approach is to investigate mutations in genetic regions that such drugs target. In such a way, researchers can treat genetic variation almost like different wings in a study, sometimes termed a natural randomized control trial. For this study, we looked at UK Biobank, a relatively large prospective cohort of around 500,000 participants from the general population with genetic data. These data are widely studied in a range of research areas to identify predictors, mediators, and modifiers of poorer health. Participants were assessed at baseline between 2006 and 2010 in one of 22 assessment centres across the UK. Since then, participants have completed several additional assessments, including attending magnetic resonance imaging, or MRI for short. The first UK Biobank participant was scanned in 2014. As of January 2021, around 50,000 participants had been scanned, with the intention to image 100,000 participants altogether. We tested for associations between specific genetic mutation in the GLP-1R locus and 3 measures of brain health. Firstly, we looked at cognitive scores, including memory, reasoning, and reaction time. Secondly, we looked at several brain structures known to be associated with cognitive impairment in aging, including total grey matter, the hippocampus, and integrity of the brain's white matter. Finally, we looked at total diagnoses for all-cause dementia, vascular dementia, or Alzheimer's disease specifically, based on ICD codes from hospital admission and episode data. We found that in the 3% of participants who possessed an A allele, compared with participants who carried only G, they showed on average statistically significantly lower levels of glucose and HbA1c, as well as around 12% lower risk of type 2 diabetes. There was, however, little evidence of association with better or worse cognitive test scores, aspects of brain structure known to underlie cognitive decline, or risk of dementia, including Alzheimer's disease. Previous trial data in GLP-1R agonists have demonstrated strong efficacy from drugs like semaglutide on cardiovascular health and potentially lower risk of dementia. Here, using evidence from low-frequency genetic mutation, we support that variation in GLP-1R associates with cardiometabolic health, but far less so for brain health in terms of cognitive, structural brain, and dementia factors. We found a small, nominally significant association with less white matter hyperintensity burden, a marker of cerebrovascular health. But this finding did not survive correction for the number of statistical tests we conducted, and it may, therefore, be spurious. Limitations to our study include potential selection bias. UK Biobank participants are known to be relatively healthy, and we have demonstrated in previous work that this can meaningfully affect estimates of association. Future studies may investigate other genetic mutations in the GLP-1R locus, more precise imaging measures, or cohorts with a higher average age. This project was a team effort. We are grateful to UK Biobank staff and participants without whom the study would not be possible. If you have any comments or questions, please do get in touch with me at donald.lyle@glasgow.ac.uk. I hope you found the paper useful. Thank you for listening.